Hello and welcome, viewers. You're watching Business World. I'm Bhupendra Paintola. It's been more than 3 decades that India is trying to fight its preventable diseases through vaccination. How far do we stand on this? For this, we have Dr. Gopal Krishna Soni. He is Project Director of John Snow India, and we will be discussing over what is the state of vaccination immunization in India. Uh, Dr. Soni has successfully led Momentum Routine Immunization and Transformation and Equity Project, which was supported by USAID. The project helped national and state governments to carry forward their COVID-19 vaccination during the pandemic. Uh, Dr. Soni, first of all, welcome to Business World.
Thank you, Bhupendra and the team for providing this opportunity to us
Yes.
on this special occasion. I think it's a very important activity, and everyone is aware that vaccination is a very important program in the country to prevent any diseases, whether it is vaccine prevent disease in the infants or in the adults.
All right. So, Dr. Soni, let me just begin with the first question. We see a disparity when it comes to the coverage of vaccination in terms of state. In Punjab, it's around, I think, 89% vaccination, whereas in the Northeast, in the Nagaland, we see it around 35%. What are the reasons would you associate with this kind of disparity in the vaccination coverage?
So basically, if I focus mainly on the COVID vaccinations, so there are certain state-specific variations are due to some of the cultural factors, vaccine hesitancies in those pockets, some fear factor regarding AFI, and if you just see some religious factors, whether it is for routine vaccination or it is COVID vaccination, then knowledge about the vaccines, the awareness in those particular areas. So there is a vast variation in the country from geography to geography, and literacy rate is definitely very different in different parts of the country. So there are multiple factors which affect the vaccination coverage, whether it is a COVID vaccinations or whether it is routine vaccination in those areas. Government is doing their all efforts to reach to the last mile through various measures with the support of each and every community engagements or partners who are supporting those areas. So there
Okay.
is geographical inaccessibility also in the country. If you have
Okay.
mentioned in Punjab, the
Hmm.
access of vaccine is very easy as
Hmm.
compared to northeast part, which are hilly terrains, difficult to reach. The road conditions are not there. So many struggles are there, and the geographical distribution of the area also. Then the disease burden. In some of the areas, the disease burden was much more. Like in COVID, we have seen there are multiple states, we have large COVID disease burden. And there the vaccination coverage was good because there was a fear factor among the people that they should reach the vaccines as early as get the vaccines as early as possible. So it was not so in the Northeast. So there are multiple regions in those areas. Definitely during the COVID times, we have seen the human resource fatigue factor also for the health workers. They are engaged for the prevention of the disease for the COVID vaccination, and then they were jumped for the COVID-19 vaccinations also at that time, maintaining all health services equally. Because the health workers have to lead for all the health services. They are not limited only for the disease prevention or vaccination, but they have to conduct other health activities also, which they are doing as a part of general health service providing through the government system. So there are multiple factors which have influenced the vaccination coverage in the country, whether it is COVID or RI. So what we expect is the same for RI also.
All right. Uh, as you have rightly mentioned, that it is a multifactorial thing, all the way from infrastructure to geography to awareness and other hesitancy factors. Uh, if I have to be specific, you have lead a project in which it was direct. You had directly contributed to the rural India in terms of vaccination. Um, in terms of hesitancy, what were the fear among the people when it comes to vaccine hesitancy? We have seen instances of the West. The people were vocal, but we didn't really, come across the rural India. Why were they hesitant, or was there a case of hesitancy at all?
So definitely when we have started our activities for the COVID-19 vaccine in the definitely in the 18 states where we are supporting the government of India and the state governments to facilitate the coverage of COVID, vaccine hesitancy was one of the reasons because it was a new vaccine for everyone. and the new vaccines were developed. So that was the main reason, the fear factor among everyone that the new vaccine has been introduced. Uh, Even the some of the doctors and the medical staff are also having the fear factor of all those areas in that particular community. So that was the main of the reasons I think what we are able to understand. Then fear of AFI was there. Then cultural beliefs, I have mentioned that. So we have also faced the cultural beliefs in those northeast areas where the vaccine coverage were there, so that we have engaged the faith-based organization to counter those hesitancy pockets in the particular areas. So overall, it was again multifactorial approach we have implemented in the project activities across the rural states where we are supporting. It's not the same thing we have applied for the northeast states or north part or the south part. So definitely we have taken care of all the different approaches which are required for that particular local areas. So we have tried to have local, hyper local approaches in that areas, whether involvement of the local folk dances are there, local natas which were conducted in some of the areas, cultural small folk and street plays were conducted to create awareness in the local language. Because the IC material what was generally developed at the national level which is basically either in English or in Hindi, but they are not able to understand languages. So go in the northeast state, there are multiple languages within that state also, and
Yes.
within the districts also, there are multiple languages. So in one language, if you are providing awareness, creative activities, they are not going to help us in that area. So we have provided the support to convert them in local languages, dialogues in the local languages, so that they can understand very easily and facilitate those myths and fear what they have regarding the vaccines. So over the period of time when the vaccines have been rolled out, some mass vaccinations have come out. We have reached so many milestones during those areas. Then we are able to report so that there are no much AFI reported through the COVID vaccines. So over the period of time, the database evidence is what we are able to generate, help us to reach those communities, to convince those communities to get the vaccination. And for definitely what we have mentioned, that we have engaged the faith-based organization. In Northeast states, we have engaged the churches for that. So we
All
have
right.
started the vaccination in the churches. So that was the important push what we have got in those Northeast states. In Punjab, we are able to get the vaccination from the Gurdwara. The Amritsar Gurdwara committee has supported us. They have issued a letter for all India that everyone should support those areas. So we have tried local inventions and the support for the faith-based organizations, even for the monetary also. We have issued some of the letters which are helpful across the country. So we have the dialogue with the faith-based organization at a different level. Each faith-based organization were engaged. It is not only one specific, but everyone was engaged for that activities, and we have taken the support of all the faith-based leaders who can convince them in the particular community whom they are able to listen that. So that was the important thing. I think has pushed the activities in that areas. Then we have done some school activities also in that particular area for innovative measures for games and board games, something like that in the schools. Because when the school campaign was started late in that area, we try to convince, mobilize, identify the ambassadors in the schools who can pass on the message to the community and lead in the schools also. Because when the students are going from their schools, they are reaching their home, they are convincing their families, and from families to other areas. So different methodologies were used to engage the community in that area through the games approach, the snake and ladder approach, what we used to have play in the older age. The same approach were used, for example, in some of the states to educate the students regarding the vaccine benefits. So these are some of the activities which we have conducted in these areas based on the local issues and challenges what we have faced in that particular state or the district. Again, it is variation within the districts and at the state levels also.
All
So,
right.
and for mobile vaccination for inaccessible areas, we have provided the support for the mobile vaccinations, whether it is required for the mobile vans, whether it is requirement of the boards, whether it is requirement of the camel cars. As per the need of the program, wherever it is required, we have facilitated those activities to reach the last mile for the vaccinations. Because government has there's some limitations, they cannot reach each and every place. Definitely, we should agree, and everyone should participate to support the government for reaching all these areas. So all the
Mm.
partners have supported not only them, right, but all the partners, international partners who are supporting those particular COVID vaccinations have supported hand to hand to the government, act as a catalyst to augment the activities what the government has taken as a decision. So these are some of the activities which we have conducted in the areas to support the COVID-19 vaccination.
All right. Again, as you have, it's very interesting to see that In the West, the resistance for the vaccination was coming from the conservative people. But whereas, as you rightly mentioned, that the faith-based organization or faith communities, they too, supported or showed faith in science and modern science and vaccination. So that is something which can be applauded. Let me just put forward this question that when it comes to the universal immunization programs, the vaccination coverage for the preventable diseases, which are more than 12. um, it took a setback in the pandemic. It what do you think? What can be done, or what is the government doing right now to accelerate and bring the pace back to the previous pandemic previous level?
Yeah, thank you, Bhupen. I think everyone is aware, definitely pandemic has affected each and every program, not only immunization. So all the health activities when the lockdown was started have come to a standby because the transport has been stopped, everything has been stopped at that particular moment. But at the initial stage, Government of India has taken a really good steps, mentioning that in April 2020, even just immediately after the lockdown, they have issued the guidelines to all the states that immunization services are a part of essential health services and they should be continued. So government has taken the steps immediately so that there should not be immunization should not be stopped. Although the immunization service was provided at that time at the fixed site, the PSCs, CSCs, or the hospitals where community can reach easily because all other roads and transportation are stopped in the rural areas or in the urban areas. So the essential health service guidelines were issued with all COVID appropriate behaviors to be followed at that time. How the sessions have to be planned, what measures have to be taken, how mobilization will take place, how the beneficiary will reach to those session sites. So each and everything guidelines have been laid down and Government of India has faced, uh, followed that guidelines and the immunization division has tracked those activities with the different states. If they are facing some problems, those problems have been locally sorted out. So initially in that area, then Government of India has taken the catch-up campaigns like Mission Routes and International Mission Routes were being carried out in some of the areas which are poorly performing to reach the last mile and to go to particular areas with the support of mobilization of the human resources and other partner agency support. So for routine mission also, catch-up campaigns were planned in those areas which are poor performing based on the indicators which have identified. But over a period of time, if you just see, India has come up with a good achievement in routine immunization as compared to other parts of the globe. We are able to reach what we are there in the pre-COVID times, and we are already almost touching that baseline what we are there before COVID and during this time. So multiple efforts have been taken. The review mechanisms have taken place during the COVID times also. The poor performing states review has been taken online with the virtual meetings, and the Government of India has taken a lead on that. How review meetings with the state immunization officer were taken. If they have any issues, challenges, they have been sorted out. So multiple steps have been taken by the Government of India and the state governments to provide the necessary service for the routine vaccination also to prevent the vaccine preventable disease. Definitely, there was a setback, but we have come up with from that also.
All right. Dr. Soni, with India heading the G20 presidency, India has called out for global collaboration when it comes to vaccinating people. How important do you think a global collaboration for vaccination is, especially in order to achieve the SDG goals?
So definitely, if you just see SDG goals, definitely we have achieved a lot in SDG goals. Our infant mortality rates and the child mortality rates have reduced. If you just see the SRS recent survey data, we have achieved a lot in those areas and yet to achieve definitely. But each and every step has been taken care to reduce the maternal mortality rates, under five mortality or infant mortality due to whatever the reasons maybe government have introduced newer vaccines also over the period of time. If you just see after 2010, multiple vaccines have been introduced in the country to prevent vaccine preventable disease. Earlier there are six or seven diseases only. Now we have prevention of from nearly 12 diseases. Some are national, some are at the national level, 11 are national, and one is sub-national level. So newer vaccine introduction was also part of that vaccine prevention disease from the vaccine preventable disease to reduce the infant mortality rate and child mortality disease. So that was the one thing I think government has taken decisions. Changing from TT to TD also has happened during this area. So multiple activities has happened in those areas to prevent vaccinable diseases. Regarding G20 vaccine presidency, I think COVID-19 vaccination has demonstrated in the world that India can do many things. And that is the largest program, I think, in the globe we are able to achieve through the COVID-19 vaccinations. We have vaccinated more than 2.2 billion vaccine doses in a short period of time. That was a remarkable achievement to the government of India. They have done, and with the introduction of indigenous vaccines also. You can imagine vaccines were developed in the country, and all the safety measures have been taken for the rollout of the vaccine in those areas for the COVID vaccination also. So the indigenous vaccines were used, the capacity of the government of India and the manufacturers were increased during a short period of time, and we are able to expedite all the process. So definitely the learnings of the COVID-19 will definitely demonstrate globally also the way we able to combat and contain the global health risk. So we are able to have the consciousness for a global health accelerator to be prepared. And I think globally, everyone should think the healthcare model, what we are able to showcase, is replicable for other countries also. We have the COVID portal with us, the name-based tracking of each and every beneficiaries, what we have given. No country has developed so far. We are the first, I think, to demonstrate those activities. Even that during times we have the vaccine mastery also, in which not only using the vaccines for our country, but simultaneously providing some support to those countries which are highly endemic for the this COVID vaccine disease. So we have supported the countries along with taking care of all the beneficiaries of our country as well as adjoining countries also through vaccine mastery. We have supported for the training of capacity building of those countries as well as providing some of the vaccines to them. We have exported the vaccines to them also. So definitely globally we have showcased multiple activities. We have done so much collaborations with the countries and within the states also, with the partners, with the manufacturers, with the other organizations. So we have demonstrated a lot of things which can be used for a part of the G20 presidency. I think that will help countries to showcase all the activities what we have done in the very short period of time, accelerating all the processes, expediting these things, taking all the safety measures. It's not that we have manufactured the vaccines without taking any safety measures. All the safety precautions have been taken care before the vaccines were used for the beneficiaries. I think all these things will definitely take up for the G20 presidencies also.
All right. All right. As you have rightly mentioned, that the global collaboration not just works for the nation, but also internationally for the global good it is. And it has been a remarkable, soft diplomatic weapon or, tactic for India also to reach to different countries. With that, Dr. Soni, I would put forward the last question for today. You have undergone, the entire journey of immunization, immunizing people. Tell us, share some of the experiences with us. Any story, any anecdotes that really, impacted you, or the zeal of the people who came forward, their stories, something that you would like to share.
So for COVID vaccination, if I can just mainly focus, there are multiple activities which has happened and they are remarkable for us, like engagement of the local NGOs in the field. For the first time in the country, I think we have utilized local NGOs that have supported, they have the faith in those areas. With the support of 26 sub-bodies in the field, we are able to reach these populations because community understand them. Community has the faith on them, local NGOs, instead of some outside NGOs going and working in the community. So engagement of the local NGOs was one of the key achievements what we are able to showcase and demonstrate. That is a localization part, which now globally has been considered for other programs also. Gavi is now promoting for the localization. That is the only word I think we have coined in the India, that through the Emirate support, we are able to demonstrate how these local NGOs can support the community engagement, how we can mobilize the community on the reliability and faith they have on the particular, because they belong to that community. So person who is belonging to that community, they will try to listen to those areas. So engagement of those NGOs is important for us. Faith-based organization engagement was one of the key critical areas which we have supported and demonstrated well. Working with the tribal groups, the particularly vulnerable tribal groups in Chhattisgarh, Jharkhand, and Odisha part, they have demonstrated this. The tribal department has supported a lot to reach that. Again, everywhere we are frustrated with the government system. So the tribal departments are working that we identified the areas, we provided the support to those areas, we reach to them and provide the vaccination with the support of them. Then, basically, health worker and frontline workers' confidence needs to be built up because they are also have some apprehensions. They have accessibility issues. If they are not able to reach the last mile, we provide the support to reach them to the last mile by any means or measures through the mobile teams what we are able to support as much as possible because we cannot reach each and every space. We know government has some constant for that also, but we whatever the partners can support, they have provided all the support to reach all those areas. And the main target was the safe vaccines should be provided to each and every beneficiary who is due for the vaccines. Tracking those beneficiaries, working with the disabled population was again one of the key achievements. We have taken the support from the organizations who are working for the disabilities,
Okay.
organizations who are supporting for the older age groups. So we have engaged those specific organizations also to reach those highly vulnerable pockets which are expected to have the disease burden. So we have multiple instances, and that all are in our mind, which can be replicated for other immunization services in the country. For the first time, the adult vaccination was given in the large scale in such a campaign mode. Although TT and TD we are giving to the adult pregnant women on all that areas, but in the mass campaign mode, I think for the first time we have faced how the adult vaccination can be done. Okay, for the disability, for example, we have mentioned that we have worked with the organizations who are supporting for the disabled populations. So we have taken that they have oriented our other NGOs how to handle this disabled population, how to mobilize, how to convince them, how to communicate with them. Also with the older age groups. Some of the organizations are working for the older age groups with the old age homes. So we have engaged those organizations also to reach these vulnerable population who cannot reach the session site, whatever the regions may be. So we have engaged different organizations who are working for different specific group of people so that
Mhm.
we can reach each and every beneficiary who are due for the vaccine doses. So these activities can be replicable for other health programs in the country or in the other immunization services also. Because for the first time, we have used adult vaccination in the mass campaign mode in the country. Never we have done the mass campaigns like this. Whatever the campaigns we have done, they're in either up to 5 years or 15 years of the age group.
Yes.
Or TT vaccine was given up to the pregnant women only, but not as a mass. So this COVID learnings can be used for RI activities. Earlier, we have developed our base on routine immunization. The existing structure which was there for routine immunization, we used for COVID vaccination. But we have built many things on the for the COVID, whether we have increased the cold chain points, whether we have increased the human resources, whether we increase the session size, we have the electronic COVID portal. All these activities, what we have done for COVID, can be utilized for RI services also. Not only for this, like engagement of the NGOs can be replicable for other health problems in the country, whether it is tuberculosis or other non-communicable diseases. How the community can be engaged, how the community can be connected through these local NGOs. The localization can be promoted for other health programs easily in the country, which can be replicated for other prevention of the health diseases. So there are multiple learnings for the COVID which can be used for prevention of the life course vaccinations or other health programs in the community. And at the review mechanisms what we have developed, the virtual meetings what we have developed. So there are so many learnings in the country which can be used for other health activities.
All right. All right. So that's sum up everything, I guess. All the way from the COVID has been a great teacher, as we can say, and be it global collaboration or collaboration on the level of communities or faith communities or NGOs, local NGOs. It tells us that united we stand, divided we fall. So that is what we can take forward and implement in future for better outcomes. Thank you so much, Dr. Soni, for talking to us. It was a pleasure talking to you. Any last message that you'd like to tell viewers?
Yes, you have just mentioned it is a power of collectiveness. All together we can do anything. And we have shown this for COVID. I think we can do it for other diseases also. So power of collectiveness is definitely helpful for us.
All
So
right.
we can
All right.
collaborate each other and work together to combat all the disease. And it has demonstrated well with the COVID burden. How
All right.
everyone has united, all ministries have come together to support this COVID program.
Great.
So that
Um,
was the message.
Thank you so much, sir, for being with us.